attending this evening. Today we're going to talk about overactive bladder and some of the options that are available in order to treat it. And overactive bladder is kind of a silent problem for a lot of people. The questions that really come up are, will I ever be able to control this? Will I ever be able to maintain my normal life? And when you all are at your primary care doctors, there's so much to go over, and sometimes you're talking about 10 different things, and this is important, but sometimes it's the 11th on the list and doesn't get talked about. But unfortunately, it's the thing that will prevent you from going outside and enjoying your activities, and can create some anxiety for everybody. And we just want everyone to know that there are quite a few good options, and we're here to help. And I think that especially in our area, there may be an undertreated population who really could benefit from the treatments we have to offer. And so, more than 64% of people who are experiencing symptoms are not, having any treatment whatsoever. And at least almost 50% report a loss of confidence. So that goes into the not going out and not enjoying the activities, and something that's very important to people, but sometimes gets lost in the shuffle of antihypertensive or high blood pressure medicines and diabetes medicines, but certainly is causing a lot of issues. These issues are common as people age, but really we see patients of all ages have problems with overactive bladder. When I was involved in pediatrics, even 3 or 5-year-olds had overactive bladder, and I've seen patients as old as 102 come into my office, and also, by the way, drive themselves to that appointment, which is pretty impressive at 102. If you have things like urinating more than 8 times a day, which if you're up for 16 hours a day, that's every 2 hours. Probably ideal would be urinating every 4 to 5 hours. If you're getting up at night quite a few times, that's a lot of time the most significant issue people have, because getting good sleep is so important for everything in life, just energy, well-being, being the best version of yourself. And it's impossible to get good sleep if every hour or two you're waking up to go to the bathroom. And a lot of times when people are waking up, it's not even much that they're urinating at that time. It may be only a few ounces, but their bladder just thinks there's more in there, and that's enough to wake you up. And it could take half hour or an hour to get back to sleep. And you do that a few times a night, you may struggle to get 3 or 4 hours of sleep a night. Using pads to control leaks or incontinence, having to monitor how much you eat or drink, that's a big thing, especially as we're getting finally out of the winter months and into a little warmer weather, hopefully soon here. Restricting what you drink and getting dehydrated may help the amount you're urinating, but it causes a whole bunch of other issues. And as we already said, planning activities around the bathroom, that's really no way to live. And there are several ways that we can kind of improve that, so that that's no longer an issue, or at least significantly improve it, so that you can get about your normal activities. So just know you're not alone. I mean, this is an extremely common problem. Really, even if I'm seeing patients for other aspects of my practice, such as kidney stones or problems with the prostate, and we ask about overactive bladder, it's remarkable how many people have this issue. And so at least 1 in 6 Americans are affected. That's 43 million adults. It probably is higher than even that. It really is something that's extremely common, but yet not talked about. So a lot of people that have these symptoms feel like they're the only one, or it's something to be embarrassed about. But just know that you're certainly not alone, and probably a lot of people you're walking by at the mall or around town have the same issue going on. And that loss of sleep and loss of confidence and self-esteem just really can drag people down, and in general you just feel worse about your general health, and kind of snowballs from there. But the good news is that there are a lot of treatments available. Each has their their positives and negatives. And these treatments, either in solitary treatment or combination of a couple, can really get you back to more control and back to your life that you led before. And I do have to say that, a lot of people ask me, how did this happen? Really, it just, there's a very complex mechanism of how the brain and the spine and the bladder and the muscle to the bladder work. And so if that gets a little bit out of out of focus, and then any one of those things can cause this to happen. So it's a pretty complicated thing to urinate, even though it seems so simple. And it doesn't take much for this to get out of balance. And so really it can happen, as I said, at any age and at any time, and really without any clear cut, oh, this happened, and then now I have overactive bladder. It kind of happens gradually and then worsens over time without a clear cause. So, there are certain things, though, that do contribute to bowel and also bladder problems as well. So what you eat and drink, staying hydrated, is kind of a double-edged sword, in that if you're dehydrated, your bowel will take some more fluid from from the stool you're forming, and it will make you constipated. But then again, if you're having overactive bladder and you drink more, as a lot of people know, then you're going to have to urinate more, and that can make things worse, especially if your bladder doesn't hold as much as it should. A bladder should hold about 600 milliliters, which is 15 to 20 ounces or so. And we see a lot of patients who are really only holding 150 milliliters, which is only 5 ounces. And so if you think that really, if you're holding 400 or 500 milliliters less in your bladder, it doesn't take much drinking of fluid to have to urinate many times a day. Caffeine certainly is an issue, and certain sodas with caffeine will make you urinate more often. So trying to mitigate how many sodas you have. And I do have patients who have, they drink 15 Mountain Dews a day. Actually just saw one today who does that. And so, that's going to make you urinate a lot more. And, just from the carbonation, but also from the caffeine. And then there's certain medications, supplements that affect urination, can cause constipation, can cause bladder dysfunction. History of pregnancy can cause a lot of different changes in the pelvic floor, some of which can be permanent. And any pelvic floor injury or surgery is another aspect that can cause issues in this area. And some of this can be improved with pelvic floor physical therapy, and we have an excellent pelvic floor physical therapy team. But some of it is too advanced and needs certain medical or surgical interventions in order to optimize treatment. So as I talked about before, the bladder and the bowel are a lot more complicated than it seems. I mean, when everything's working right, it's just seamless. You go to the bathroom and it's really kind of a thoughtless exercise. But in terms of the science of it, there's a lot going on, and any disturbance in that whole pathway from the brain. We see this in spinal cord injuries, where there's a disconnect between the bladder and the brain, and then the nerves that travel down, surgery of the lower pelvic area. We see that with colon cancer surgeries at certain times, where there's some stripping of the nerves, as one example of many, and certain gynecological surgeries as well. Those affect that pathway and the nerves, and then there's a whole set of different pathways from the where the nerves exit the spine to the bladder, and those pathways can be disturbed. And even the neurotransmitter, so the molecule that the nerves send out to the bladder, that can be too overactive and cause issues with how the bladder contracts as well. So and then even beyond that, at the bladder level, the urethra, which drains the bladder, if there's narrowing there, the bladder has to change the way it functions in order to push fluid through, and that causes almost like a muscling up. But unlike a bicep exercise where you're trying to make it stronger, if the bladder gets too strong, it can not hold as much and cause issues with urination. So you can see that's just a certain example, a set of examples of problems you may have, but it can really be anywhere along that chain, and it's quite a complicated process. And so common bladder and bowel control problems include stress incontinence. That is oftentimes, typified by post childbirth, where the pelvic floor becomes stretched and the sphincter that holds urine is less strong, and so that's oftentimes fixed surgically, but can be worsened by overactive bladder as well. As you can imagine that if your bladder is less strong or is too strong, it'll overwhelm that sphincter. Urinary retention, we see this all the time. That's actually the opposite of overactive bladder, where the bladder doesn't push hard enough. Diabetes is probably the number one reason for that, but if those nerves are stretched or compromised during any type of pelvic surgery, you can get urinary retention. Or sometimes if there's just too much of a blockage for too long, the bladder gets damaged and it doesn't push hard enough, even after we relieve that obstruction. We see that a lot in men with big, with enlarged prostates. And over time, if that prostate is not, fixed or the obstruction is not relieved, then they have long-term urinary retention. And we don't have a great way, a lot of times to fix urinary retention, although with certain spinal stimulations that we'll talk about, it gives us a better opportunity in certain patients to allow their bladder to empty when otherwise it would not. And then overactive bladder, we've been talking about. That's a very, very common problem. We see that every day in clinic. And as I was saying before, patients who have other issues that come into our office, if we ask these questions about overactive bladder, it's amazing how many patients come in with a kidney stone and, oh, by the way, they've had overactive bladder and they're having incontinence, and it's something that's distressing to them. So when we ask, we find that a lot of patients are kind of suffering in silence. And then fecal incontinence, the same nerve roots that go to the bladder also go to the bowel and the rectum. So when there's dysfunction of the bladder, we find a lot of patients also have frequency of stooling as well, and that can cause some of the same issues as overactive bladder, meaning that concern for going out and worried about having an episode out in public, much the same way that overactive bladder and urinary incontinence can cause that issue too. So as I touched on, what is stress urinary incontinence? That's when, very common sneezing, coughing, laughing, or exercising. It's usually when there's not enough strength of the sphincter. More common in women after childbirth. Men can also have stress urinary incontinence, sometimes due to overactive bladder, sometimes also due to having prostate surgery. So that is really typified by, you don't really feel your bladder contracting. It's just when you're moving, you have some incontinence or leakage of urine that really you don't feel, as opposed to if there's overactive bladder and urge urinary incontinence, which we'll talk about, that's when there's a inappropriate contraction. You feel like your bladder is trying to urinate, and then there's incontinence due to the bladder pushing too hard. Urinary retention, really it's the lack of sensation, because patients who come in with urinary retention, a lot of times they're shocked to hear when we do an ultrasound of their bladder that there's 700 or 900 milliliters in the bladder. So 2 cans of Cokes or more are sitting in their bladder and they think they're empty. And so this is typified a lot of times by a weak or dribbling stream, a stretched out bladder. If there's no obstruction, sometimes we can use a nerve stimulator, but if in the absence of the nerve stimulator working, a lot of patients have to use a catheter or catheterize themselves. Overactive bladder is typified by feeling that you have to go to the bathroom. That's what really separates overactive bladder from really all of these others, is that everything else is working and in order, but it's the bladder itself, or at least the nerves that are going to the bladder that cause the bladder itself to empty more frequently than it should. And the bladder really has only one function, which is to store urine to a certain size. And it's amazing that it does that, because, if we all only held 100 milliliters, then we'd all just be going to the bathroom all the time. So it's great that it has that storage capacity. And with that storage capacity, if it changes too much and it becomes less, then we have to go to the bathroom a lot more. So the bladder actually has to sense that there is urine in it and have an appropriate amount of distension, and then contract at the right time. But as you can imagine, it's quite easy for the bladder to contract when it shouldn't, contract at too low of volumes. I mean, any of my patients or people who are on this seminar who have ever had a kidney stone and had a stent in the bladder, really they know that the bladder really does one thing. And so when the stent rubs in the bladder misinterprets that as there's urine in the bladder. And what does it do? It tries to get rid of it. It tries to contract. So a lot of patients with stents in the bladder, because of that rubbing, are urinating quite a bit at night and have some irritation. And so the bladder has to sense an appropriate amount of urine, distend to the right amount, and then empty the right amount as well, because not only is it's not good enough just to hold the 600 milliliters, but it has to contract enough so that it goes down to zero. If it goes down to 200, and then that's it, and doesn't fully empty, there can be infections, damage to the kidneys, increased pressure in the kidneys, and then injury to the bladder over time. So that's what typifies overactive bladder. And really, there are some people whose bladders just always have a certain tone, and it feels like their bladder is never truly empty. And that is bothersome. It hurts concentration, and at night it makes it difficult to sleep. So fecal incontinence, that involves bowel movements, and that's surprisingly related to the bladder as well, just because the nerves go to the exact same spot in the spine. So, patients, just like with the bladder, can have an inability to resist the urge to go. The rectum has to recognize that there's stool there, but also, hold it and not give you constant feedback when you don't want that. And then when it's appropriate and there's enough, just like the bladder, it has to trigger the mechanism to empty that. And so whether it's fecal incontinence or whether it's urinary incontinence, stress, or urge urinary incontinence, these can cause complete planning of activities around the bathroom, stained underpants, and having to use multiple pads a day or depends. And I see that, with a lot of my patients who are using 8-10 pads a day or multiple diapers a day. And to them at this point, that's just a normal way of living, and certainly affects their quality of life. So there are quite a few ways that more control can be obtained, and there are lifestyle changes, decreasing caffeine, or certainly soda drinking, getting more exercise, staying appropriately hydrated with hydrating medicines. I have some patients who tell me that they don't know why they're dehydrated. They drink coffee in the morning, they drink maybe a soda in the afternoon, and they have a beer or wine at night. And I just have to remind them that all those things are dehydrating. So even though you're drinking fluid, you're actually having a net loss of water. So your body will compensate, meaning that those who are dehydrated will hold more water, but it does cause effects. And so making sure you're appropriately hydrated, not overhydrated, is really important. And then there are oral medications for the bladder, and we'll get into that. And each set has its pluses and minuses. And then there are some advanced therapies, of which there's Botox. We'll talk about that. We use that in our practice quite a bit. And then there's Interstim from Medtronic, which is a nerve stimulation and has significant benefits as well, especially if there's severe cases or patients are not responding to more conservative management. So some of these lifestyle changes, we talked about diet. It is important to not get constipated. Not only does that affect bowel movements, of course, but it really does affect the bladder, because in both men and women, the bladder sits on the bowel. So if you're really constipated, then you're going to push on these nerves that go to the bladder and push on the bladder itself. Appropriate exercise, I mean, there's really, besides the risk of joint injury, so you have to be careful, but even, walking or water aerobics if you swim, but really some form of exercise daily pretty much helps everything in life. It's just like sleeping, getting optimal sleep, of which overactive bladder can harm that. But getting good exercise every day and getting really good sleep every day, pretty much every human on this planet can benefit from those two things. And that no doubt helps with proper bowel movements and helps reduce this overactivity syndrome as well. And then, you can do biofeedback. It can be tough. I try to tell patients, if you can initially, if their symptoms are mild, then try to force the bladder to urinate every 4 hours, meaning during the day. If you feel the urge at 2 hours and it's strong, but you can suppress it, try to do that. And for some people, it will work, that their bladder will learn to hold more urine and not urinate every 2 hours, but eventually every 3, every 4, and then that translates to at night. In some people, it works really well. In others, it doesn't work as well. And then physical therapy and pelvic floor strengthening, those kind of go together. And Kegel exercises, especially if you have stress urinary incontinence, are very helpful, and doing about 60 a day or so properly. We have handouts in our clinic, and there's also the proper way to do it online. But doing that well, and maybe taking a day or two off just to let the muscle relax. I mean, there is too much of a good thing with that. Same thing with pelvic floor physical therapy. You can get exercise. We have excellent pelvic floor physical therapy team, really one of the best I've ever worked with at Avita. And, so they can do kind of more advanced investigation, examination. And the pelvic floor, if you actually look at an anatomy book, is incredibly complicated. And there are so many muscles and different ligament attachments in the pelvic floor. It's really fascinating. And out of all the anatomy that I learned in medical school, I found it to be some of the most challenging, just because there really is so much complexity to the pelvic floor. So it doesn't take too much for it to get a little bit off kilter and get strained. And so pelvic floor physical therapy for most patients, I would say, can be beneficial. We're kind of, going back to the exercise, sitting a lot all day. And that's kind of our routine. And so it's very, very easy for that pelvic floor to get tight. And that can cause quite a bit of problems with the bowel and the bladder. So oral medications for the bladder, there really are two different types. And without getting too technical, there's anticholinergic medications. Those have been around the longest. And probably for those who have had overactive bladder, that's probably what most of you have been started on first. And then there's also alpha agonists. So the anticholinergics, like the well-known ones, I'll just name a couple, are oxybutynin, Vesicare, and which is sulfasen. There's a whole string of them, and then they all work the same way. Sanctura, and then there really are two alpha agonists that have only come out, one in the last maybe 5 or 10 years, and then the other one maybe about 15 to 20. So they haven't been around as long, and those are mirabetrol or mirabegron and Gemtesa. So the benefits of the anticholinergics is they do work quickly, and they are inexpensive for the most part because they've been around a long time and they're all off patent. The negatives, though, I think are really noteworthy for all of them, and they all cause dry mouth. They can cause constipation. They also, with the anticholinergics, there's some evidence that they increase the risk of confusion, especially in patients over 60 years old, and even dementia. So we have to be really careful about overprescribing those. And we do, especially, and they do work, but we have to very carefully monitor side effects. So these are not medicines without side effects. The alpha agonists, the mirabetrol, mirabegron, and Gemtesa, they do work well. Mirabegron or mirabetrol, same medicine, just trade versus, on patent name. They can cause hypertension and interact with other medications, mainly that mirabegron, the older version of the alpha agonist. Gemtesa, I'm seeing a lot of good results with it. People can get dry mouth. Both of those medicines take about 2 to 3 weeks to start working. And for those, particularly Gemtesa, that are having good results, it really does work well. Our biggest issue with Gemtesa currently is that it's very expensive for most people. If you have an insurance that covers it, consider yourself lucky. I think some Anthem and Blue Cross plans do, but right now we're having a lot of problems with most other commercial and Medicare, Medicaid plans, and VA as well. It's kind of hit or miss, and for some people, it's a lot of people it's $400 or $500 a month, which is a lot to pay for an overactive bladder medicine when people may be taking 5 or 6 or 10 other medications. So some encouraging things with Gemtesa, and we'll just have to wait for the price to come down. And it doesn't work for everybody. I mean, there's some people it works well, but I find a lot of people who have pretty severe symptoms, it can only do so much. And then, there are advanced therapies, and you can put the Botox in that as well, and we'll talk about that a little bit as well. And then, of course, the nerve stimulators, where there's Medtronic has a couple products. One is the InterStim device, and we'll go over that in detail. And that's a nerve stimulator that directly stimulates the nerves that exit to calm down the bladder. And then there's a peripheral nerve. So on your ankle, there's a nerve that feeds back to the same area that you would stimulate more centrally. And although I would probably say that the more central nerve stimulator, the InterStim, works a little bit more in patients. For some patients, the Medtronic Neurosystem works very well as well. And the injected medications are the Botox, which in some patients work very well, and we'll talk about that in a minute. Bowel control is best served with an InterStim or a stimulator. There aren't as many medications that work well for the fecal incontinence. So for patients who have both fecal incontinence and who have bladder incontinence, the nerve stimulators can really be a game changer. So Botox is an interesting medication. Of course, it was really made famous because of anti-wrinkle prevention in the face, but from a non-cosmetic medical perspective, used in muscle stiffness. It's also used for gastric diseases and problems swallowing. There's a whole lot of things that it can be used for, and it does work well by working at the muscle level. And in a lot of studies, the effectiveness is comparable to oral medications, but I will say that in certain patients, Botox works where the oral medications don't. So we are doing a decent amount of Botox in the right patients in our office. The disadvantages of Botox are that it does wear off. So the body does metabolize it, and it does wear off after a certain period. I love to get about 9 to 12 months when I inject Botox in patients, but sometimes we get as little as 3 or 4 months. So we always have to see how does the body metabolize it, and how well does it work over time. And there is a possibility for self-catheterizing. That would be temporary if you have Botox, meaning that if you do have problems with retention, then as it wears off, then that will go away. But it can cause retention if the dose is too high or if the body is very sensitive to it. So we do inject Botox in the office and in the operating room. And for certain patients, it works really well. For others, it doesn't work as well. And it's just a matter of who responds to it and how long they respond. Because if they're needing Botox every 2 or 3 months, then that patient's not a good candidate. But if someone responds, the response is durable, then it can kind of take the place of certain medications, and is also overall pretty minimally invasive. So the Medtronic Neurosystem is kind of an interesting development in that if you look at the picture on the far right, there's the tibial nerve, which runs behind the ankle, feeds right back into the nerve roots that then feed into the bladder. So it's kind of an interesting thing that if, in some patients, if we stimulate this nerve all the way down to the ankle level, then it can feed back to the bladder and reduce the impulses that go to the bladder and overactivity. The advantage is it's done in the office. It's a 30 minute in-office session. You come in once a week for 12 weeks, and the patient to the far right of the screen, I think, is very typical in that it's not painful. The needle's very small, and patients, once they get it in, have really no pain and are able to read, relax, get their treatment, and then go home and resume all normal activities immediately. And if it works, and it doesn't work for everybody, but if it does work, then most people need monthly maintenance sessions after that. And they do that for sometimes indefinitely, once a month, to keep the improvement. And this is something that also can be done in conjunction with other therapies. Some people do well with medications in this, or even Botox in this. So it can be done in combination quite safely with other therapies, and really doesn't have a lot of potential side effects. The biggest side effects if it doesn't work or it wears off over time, but in those that it works, they seem to get a long-term benefit. And then probably the most effective method for controlling overactive bladder, and particularly overactive bladder that is not responding to other treatments, is the Medtronic InterStim system. So if you look at that picture to the right, it is a nerve stimulator that is a very small lead that stimulates the nerves that go directly to the bladder. And when that nerve is stimulated, it actually causes less stimulation to the bladder and allows more appropriate filling of the bladder and emptying of the bladder. And it really works quite wonderfully. And in patients who aren't responding to anything else, it's really gratifying to see how quickly this can work in them, because for a lot of patients, this can be done initially before you even have any medicine. So, if you don't want the side effects of the medicines, this is something that can be done immediately. I would say a lot of the patients I see are ones who are referred to me because everything else has failed. Sometimes primary care has tried other therapies or other urologists, and so this is a last resort even situation. But really, it can be upfront even before any medical therapies are instituted if someone wants non-medical therapies and instantaneous relief. And also, what's kind of been a game changer, I think, for spinal stimulation is how easy it is to do an office test. So nowadays, we've developed techniques where we can do an office test, which is done in the office with a little bit of numbing medication. You lie on your belly, and it takes about 5 or 10 minutes to do, where we are able to place a temporary lead into this area based upon landmarks that we know are there. And we test for the stimulation with certain things that we're looking for. And we're able to place these leads, and you actually have a temporary lead for a week. And with the temporary lead, it's kind of a great test that doesn't necessitate going to the operating room. If the temporary lead causes a greater than 50% improvement in symptoms, then you get the permanent device implanted in the operating room. So with this therapy, we're able to kind of test the effectiveness, and even a couple patients this last 2 weeks, we have to remove the lead after about a week that we do because it's temporary, but they were like, I don't want to remove, can you keep it in, because it's helping so much that I don't even want a 2-week wait for the surgery to get the real lead in. I would just like to keep it in until then, but we can only leave it in a week, and so we did have to remove it. But they were getting such an improvement just with the temporary lead that they wanted to keep that in until the day that they got the permanent lead. And with the permanent lead, the batteries are getting better and better. I mean, when I first started, sometimes they were only lasting 5 years, and now it's routine for them to last 10, depending on how much energy has to be used, even 15 years, sometimes more. There are rechargeable options, and the batteries that are recharge free have more capacity while being the same or smaller size. And so these batteries are lasting quite a long time before having to be replaced. And certainly these therapies are proven in the literature to be more effective than medications or Botox as well. So there's really strong evidence for just how well that works. And so, this is a slide that kind of talks about that office test that we do. And the patient to the far right kind of shows there's a small battery. There's a temporary lead that's placed to stimulate the nerve. And we have you do a bladder diary for that week to see how your pre implant has worked compared to the post implant phase. And for most people, it's quite dramatic. I mean, I've had patients go from 7 to 10 voids a night and incontinence pretty much all day to just maybe getting up once with the temporary. And the permanent lead is going to be even better because we use X-ray to put it in, and it's put even in a more specific spot. So we do leave it in for typically about 6 to 7 days. In my practice, we do these on Tuesdays and Wednesdays, mostly on Tuesdays, and then you come back the following Tuesday. We review your bladder diary and kind of assess how well you responded to that. And really, for most people, because we kind of carefully select who we're even trying this on, I would say that probably 9 out of 10 who have the implant or more are going for the permanent implant after the temporary one. And then, of course, at that appointment, we do remove the temporary one and plan for a permanent one. The temporary one has that generator that's outside the body, but the permanent one is all under the skin. So once we implant the permanent lead, it's under the skin. You can go about your normal activities, exercise, and go about your daily life. So that there's nothing external with the final implant that's done in the operating room. So Medtronic, is a very big and well-organized company. So they have so many things for patients that are so helpful. And one of the things is they have an app, and they actually give you a cell phone that you can use to control the InterStim device. So with the rep always helping you every step along the way, programs can be changed just with your app right at your home. The power can be increased, and that's one of the great things I think about the InterStim therapy is that it's customizable, meaning that there are at least 8 settings that one can have, and also every one of those settings can have different power strengths. So all that can be implemented through a Wi-Fi connection with a phone that is given after the procedure to you, and is very easy to do. And there's also a lot of other Medtronic web information and support as well. So that's a huge benefit for patients, and the Medtronic representatives do a great job, and they're helping patients every step of the way. And every time that I've had patients interact with them, they have nothing but huge praise to all the Medtronic reps and their dedication and what kind of care they give after the procedure and every step along the way. So I think this is an important aspect of the InterStim that wasn't the case when I first started doing these, is that now, for the most part, they're MRI compatible. And so I get this question all the time, is that, what about the stronger MRIs? And for prostate cancer, we're now getting the 3 Tesla MRIs, and so need that stronger magnet. And it used to be that a lot of things, including these, were not compatible, but now there is an MRI mode. If you do have an MRI or need one, do let us know, and then we'll be able to put it in MRI mode so that it's safe. So it's something you need to let us know about. But these devices now are MRI compatible. You're able to go through airport security, and just the technology, even over the last 10 or 15 years. I've been practicing since 2009. It really has improved quite a bit, and I'm amazed at all the dedication and research and development that Medtronic has done to improve their technology in such a short period of time. So who would benefit from this therapy? Really, if you have significant symptoms, certainly if you have symptoms that are not responding to other forms of therapy, then this is really considered a therapy that works when others don't. But I encourage people to think about this even earlier on. The benefits are there aren't side effects. It works better, so you're going to have probably a better response to the medicines. The medicines may reduce your symptoms so that they're more tolerable, but most of them are not going to take them away. This InterStim has a definite chance to do that, and we test it, as I talked about, before we actually implant the formal one. So you'll have an idea of how much it'll help you before you have any trip to the operating room. And certainly, if treatments haven't given you the relief you want, this is kind of the treatment that is the treatment of last resort, but doesn't have to be. It can be earlier on. But if you've tried other therapies and conservative managements and nothing's working, it's kind of the one that works when others don't. So it has been around for quite a long time. There's high satisfaction, especially in appropriately selected patients. And so, greater than 8 out of 10, or even up to 9 out of 10 of patients say that they're satisfied with the treatment. And certainly, and I can say this anecdotally in my practice as well, and the literature bears this out, that there's greater improvements in quality of life compared to medications just because it works more effectively. And it's more customizable as well. And I'm not saying that medications don't have their place, they do, and we use them every day. But if there's going to be one treatment that's going to be more effective than medications, it's certainly going to be the InterStim. And it does seem to work long term. Sometimes we need to change up a program, but as I said, that's easy to do with the customizable app and phone that's there. And so the long term success of these is really good. And actually, now that I'm in Middle Ohio, there are patients who had implants that were placed 15 years ago that are coming to my practice, and the battery kind of died, and we're reimplanting them. And like, wow, I just can't believe how much this is working. I should have done this 10 years ago and kept up on it, because I just forgot how much of a difference it makes. And there's hundreds of thousands of patients over at least a quarter century who have been implanted successfully with minimal side effects and also high patient satisfaction. So this is certainly something that I don't think a lot of people know about, and is very effective overall in the right patient. And so these, are some ambassadors of InterStim and some of their real life testimonials. And this is what I hear quite a bit in clinic, is that it's allowed me to fully live my life in such a free way now. As we talked about earlier, the constant struggle with overactive bladder and incontinence can really create a lot of anxiety and prevent patients from living their lives and even going out to activities. So it really can make a difference, and all these treatments can to a certain degree. And InterStim is the most effective of them. And we hear this as well. I can do so many things I want with less worries. This is so empowering, and that's a very frequent comment that we hear. So I appreciate all your time, and just know that you're not alone if you have overactive bladder or urinary incontinence. Far from it. And Vita Urology, myself and our team is in Medtronic as well, is very happy to help and kind of find the right treatment for you so that you can get back to living your life and have this be one less thing to worry about. So if there are any questions, I'll take them now. And thank you so much for your time and attention.